work. Okay, last but not least, we said function, fitness, nutrition, and education, right? So how does the functional component work with this? Well, what controls all your cells? Your brain, your nervous system. What controls all of your organs? Your nervous system. What controls your pancreas, regulating your blood sugar? Your nervous system. What controls the insulin receptors on the surface of the cells? Your nervous system. Every cell, organ, tissue, and molecule in your body works because of the inborn wisdom, the infinite intelligence that God put inside your body, and it uses your nervous system as a conduit to communicate to everything in your body, to keep everything working. And if there's any interference to that system, it can stop your body from working the way it's supposed to work. And so what I'm saying is if there's an interference in your spine, if bones are out of alignment and they're interfering with that system of communication for the brain to the body, can it cause diabetes or other health problems? And the answer is yes. It's called subluxation. And I had a lady walk in my office and she was like this, like, Dr. Yachter, my back is killing me, can you help me? Like, yeah, come on over here, let's get an x-ray. That's what I saw on the x-ray. And when I looked on the x-ray, the bone was wrenched, tilted, twisted, turned out of alignment, and it was pinching the nerve. And I didn't think much of it, except that's why it's causing her back to hurt. So I said, Georgia, come on over here, lay on the table. And I laid her on the table. Very, very gently, I started trying to unlock the joints, get the bones moving, get the pressure off the nerve. And I felt a little bit of movement in there. And she gets up off the table, and she's not standing like this. She's standing like this, straight up, just like that. I'm like, wow, that's pretty good. And when she stood up, she had an insulin pump on. So I didn't think much of it other than the fact that she'd been diabetic for 40 years, but she's got an insulin pump. All right, no big deal. So Georgia, come back tomorrow so I could double check, make sure you're doing okay after your first adjustment. By the way, you might get a little sore, but don't worry about it, just come back tomorrow so I could see you. So she leaves, and about an hour later, somebody runs in off the street telling me that one of my patients is passed out in her car. And I ran out there, and there she is, she's passed out in her car. She's been passed out in her car for an hour. I ran in, I called the ambulance, and they come, and the ambulance pulls up. And before they pulled up, I ran out and I gave her some orange juice on her lips, and she started perking up a little bit, yeah. But then the ambulance came and took her away, and I'm like, oh my gosh, what did I do? I thought I helped her. She stood up straight. It looked like I helped her get up off the table. She was like, boom, just like that. Look good, and then she goes to the hospital. What did I do wrong? So I didn't sleep much that night. I come in the next day. I'm working on patients, and the front door opens, and who is it? Georgia. Yeah, she's got a big old smile on her face. She's smiling ear to ear. She's happy. She's got this big glow. It doesn't even look like her. She looks 20 years younger. She walks over to me, and I'm thinking she's going to knock me out and just punch me. And so I started backing up. She lunges in and gives me this big hug. She's, Dr. Yachter, I don't know what you did yesterday. I haven't slept this good and felt this good in 40 years. Can I have another adjustment? I'm like, yeah, you got it. No problem. So I said, Georgia, before we do that, I need to show you something. I said, that thing we found on your x-ray, that subluxation, that was putting pressure on the nerve causing your back to hurt. Turns out that nerve was the same nerve that was going off to your stomach and your pancreas. And I think when I opened up the nerve channel there, it started restoring function to the pancreas. Your pancreas started making insulin, but your pump was still on, so you got too much. And I think that's why you passed out in the car. She's like, that makes sense. Are you going to adjust me or not? And I said, yeah, I'm going to adjust you, but I just wanted to tell you what I think happened. So she didn't care. She just felt so good. She was addicted to the crack, It's like, all right. So I'm adjusting her, and she's coming in, and then we do her progress evaluation a month later. She's like, I felt great. I have no pain at all. By the way, my doctor reduced my insulin requirements from 8 units. I'm down to 5 now. I'm like, wow, that's awesome. Good. And then we do another progress evaluation 4 weeks later. She's like, by the way, I'm down to 3 units now. Excellent. Another month goes by. She tells me she's down to 0.8 units. From 8 units to 0.8 units, her endocrinologist at the University of Miami wanted to know what my clinical protocol was for treating and curing diabetes. He wanted to know if we'd be willing to share that protocol for the study that they have that they're putting her into at the University of Miami, because they never saw a 67-year-old brittle diabetic make a recovery like that. She's almost off all her insulin, like the gentleman you saw up there. So what did I have to explain to them? No, I'm not willing to share my clinical protocol because I don't have one. Okay, it's called I move the bone and God does the healing. Why? Because nothing. I didn't put anything into her body or take anything out. There was just an interference between the brain communicating and coordinating a normal cellular functional response. Now, she was taking insulin. She could have ate better. She could have exercised. She could have done all those things, but if the subluxation wasn't removed, what would have happened? Would have had very little effect on her, you know? So do you understand core 4, guys? That's why we say function, fitness, nutrition, and education. Function comes first. That's number 1. You build your house on a solid rock foundation. You could eat good and exercise till the cows come home. But if you've got neurological interference to your spine, you'll never be 100% of what your God-given potential is genetically or at any cellular level. And that's what a well-skilled, qualified chiropractor will teach you, will support you, and check you for. You know, not just to help you feel good, but to make sure that you stay good, to stay well, to stay at your best. Everybody here said they want to be at their best, right? Everybody. Yeah, so the question is, how come the whole planet isn't getting adjusted? Well, you know, unfortunately, chiropractors are known for treating just back pain. But this subluxation thing started back in 1895, September 18th. A deaf janitor had his hearing restored. It's in the history books, and if you go to Davenport, Iowa, you'll see a big bust on the street, on Brady Street, of the first chiropractic adjustment. And that's what it's known for now, only because of monetary reasons, to get us insurance equality and all that stuff. But you're getting the truth tonight. And you know, your health is, it's up to you, what you do with that, what you do with that message. And I've given you a lot tonight, didn't we? Yeah, so most of you guys know that your spine is like a circuit breaker. You just got to make sure the power's on. And you can't tell if the power's on just by how you feel. You have to go by technology. And if you do have aches and pains, hurting, tired, fatigue, numbness, weakness, headaches, brain fog, neck, back pain, yeah, by all means, that's a good reason to have your spine checked. But that's like getting your teeth checked when they hurt. You know, it takes a lot more time and money to fix that. Isn't it smarter to do it before it hurts? Yeah. So it's the same thing with your spine. You know, the testing we do is NASA space technology. Scanning your spine will show us where there's abnormalities compared to a normal scan. You can see the difference, right? So testing is important. If you're a patient here and you're continually having your spine checked, how often do we do these scans? Every few months, right? Because we don't guess, we test. I want you to feel good, but we want to know if there's a problem there. If there is, we what? Nip it in the bud. Okay? The other thing is that we'll take an x-ray. And the x-rays, we do a comparative study.